Hi, my name is Dr. Marianne Brandon. I'm a clinical psychologist and certified sex therapist, and I'm in private practice in Annapolis, Maryland, USA. And I'm here to talk to you today about premature or rapid ejaculation in men. Now, I'll be speaking to you about a patient of mine, Matt, and I say the word patient in quotes because Matt doesn't really exist. He's actually a composite of my patients, so I didn't have to change his name because he's not real. But you may find aspects of Matt within yourself. Matt's in his early 40s, and he felt that he ejaculated too soon all of his adult life. He's been concerned about that for a while, and he's concerned about giving his partner enough pleasure. It turns out that Matt actually typically had an orgasm after about 4 minutes of intercourse, which is within the range of normal. So while he thought he had rapid ejaculation, we wouldn't diagnose him as such. Most researchers suggest that we would diagnose a man with premature ejaculation if he had an orgasm within about 1 to 3 minutes of entry. Most men last more like 5 minutes. However, about half of men report that they would like to last longer in bed. So what causes rapid ejaculation? Well, there's some speculation that it's genetically related. Some new research is pointing that there's some potential genetic causes, but most of the time we think about it as a psychological issue, often related to what we call performance anxiety or performance in the bedroom. It can also be related to feelings with one's partner like anger or unresolved emotions, and that can translate into having an orgasm sooner than a man wants to. And it's also true that if a man is not tuned into his body and feeling connected to his body, he's not going to be aware of his level of desire, and he'll probably have an orgasm sooner than he wants to. So what about treatment? Well, interestingly, there are medications that have side effects that benefit men who feel like they have an orgasm too soon, and that is SSRIs. Those are antidepressants that typically have sexual side effects, and for men who have premature ejaculation, it can help them last longer. If a man goes to therapy for treatment of premature ejaculation, what typically happens is we encourage him to masturbate and learn how to become more in tune with his level of arousal. So, for example, he can rate himself on a scale of 1 to 10, how aroused he is, and as he starts to feel that he's increasing on the scale, approaching more like an 8, that tells him that he's going to be having an orgasm quickly, and so he needs to learn how to bring his level of desire down. Now, a man can do that by slowing down the stimulation or even stopping, or he can learn to literally spread that desire throughout his body. That's a technique that is taught in Tantra, where they take the sexual energy that a man feels in his pelvis and he moves it up his body or down his body, so he spreads it out and it's not quite as intense. After a man learns how to rate his level of desire and keep it in a certain range by himself, then he learns how to bring those skills into the bedroom. One important thing to remember is to stay in tune with your body and don't think about baseball or whatever it is that men say they should think about so they don't have an orgasm. Because what that's going to do is make you less in touch with your body and then actually improve the chances that you're going to have an orgasm before you want to. So relax after you enter your partner and take a moment to center yourself so that your excitement doesn't take you over. And you'll find that while you're making love, it'll probably be helpful to slow down at times and pay attention to your partner while you give your own body a chance to sort of slowly come down that scale a little bit. So play with your partner's hair, or kiss your partner, or talk to your partner, tell them that you love them. Those are sort of benefits to sex for your partner. They're going to enjoy that. That's going to increase their level of desire, and it's going to give you at the same time an opportunity to cool down a bit. Now, also you can have sex toys around, so that if you do have an orgasm sooner than you want to, get out a sex toy and continue your play that way. The bottom line is there's so much more to sex than intercourse, and that's important that you keep that in mind, that you can make love to your partner in so many ways that are outside of intercourse. And the more tuned in you get to that, the more exciting your lovemaking is going to be in general. If you have questions about anything we're talking about here, there's a great book called Coping with Premature Ejaculation by Metz and McCarthy, and you'll find what I'm discussing here further explored in that book. So I hope this video was helpful for you today. As always, remember that these videos are not a substitute for treatment, so if you have concerns, consult your doctor. However, we invite you to bring up your reactions on our discussion forums and ourgyn.com, and I'll do my best to respond to you on those forums. As always, remember that great sex is important, but it's much more important to learn how to give and receive love better. Thank you.